Welcome everybody to Miller Johnson's webinar, Top 10 Questions from Employers Regarding COVID-19. Although my understanding is the latest and coolest term for coronavirus has evolved from COVID-19 to C-19. So that's information for all of you. This is Sarah Willey from Miller Johnson. I'm here with my colleague, Sandy Andre. And we are going to be presenting this webinar today with the support of Miller Johnson's entire employment section. As most of you can imagine, everyone in our section has been taking a number of questions, has been carefully tracking recent developments with regard to C-19. And so we wanted to present this webinar today to all of you to answer the questions that we think are at the top of everyone's mind. Of course, these are the questions and answers that we think are relevant as of this minute. As you guys are all discovering, that is continuing to change very, very quickly. So our intention is also to be following up this webinar with at least weekly updates, if not more, for all of you so that we can continue to keep our clients in the loop as to best practices, recent legal developments, and answers to your most emergent questions regarding COVID-19. The other thing I'll say is that Miller Johnson as a whole is recognizing that there are widespread and significant ramifications for organizations that go beyond human resources and what's happening from an employment standpoint. So we are going to be touching on all areas, employees, customers, public relations, finance, taxes, etc. So you will be seeing a lot more from Miller Johnson in the upcoming days with regard to those concerns as well. This webinar is going to address a lot of your questions. It is based on what we know right now, and there is going to be a recording of this webinar available after we've completed it. There is a button for you guys to ask questions, and we will do our best to answer those questions during the webinar. If there are questions that go unanswered today, likely we will be taking those on in the upcoming days too. One thing that I do want to note before we dive into the content is that we have a whole lot of questions involving whether we should, are obligated to pay employees who can't work because they're impacted by C-19. It is looking like today, federal Congress is going to pass a law that is going to speak to that, and it's going to provide economic relief for those employees. So we're going to answer those pay questions based on what we know right now, but keep in the back of your mind that it may be within the next few hours, by the end of the day, or even by the end of the weekend, that approach could change significantly depending on what gets passed on the federal level there. So I want to introduce my colleague, Sandy Andre. Sandy is an attorney here with Miller Johnson, and she also worked as in the human resources field for several years before she went to law school. So we have the great benefit of not only having Sandy's legal expertise and the fact that she's been carefully tracking every single development regarding C-19, but she also very well understands and knows the questions that you guys are likely all getting from an HR standpoint. So Sandy's going to talk through a number of issues, and then I am going to interject from time to time and take questions as we go from folks. So with that, here's Sandy.
Okay, good afternoon, everybody. We are going to go ahead and start addressing the top 10 questions. Number 10, is this a pandemic? As Sarah said, this is certainly an evolving situation. And as of just a couple of days ago, March 11th, the World Health Organization, or WHO, declared C-19 a pandemic, which means that it is a worldwide spread of a new disease. And so why that is important for our purposes is that the spread and the impact has been declared to be increased. And so the actions that we need to take and employers need to put into place, more intentionality into thinking about what those would be, are important. So additionally, although this is the first pandemic that has been sparked by a coronavirus, we have seen and overcome other pandemics. So back in 2009, and the H1N1 virus, and then several other public health emergencies such as SARS and MERS. So again, the WHO declaration of pandemic means it certainly indicates the spread of the virus itself, but not necessarily that it is an indication of severity, more just the spread. Question number 9, how do I keep it out of my workplace? Well, by now, you may know that the current thoughts on transmission indicate that it is transmitted through close contact, right? So close contact meaning within 6 feet for a period of 10 minutes or more in the exchange of respiratory droplets. We're currently uncertain as to whether it can spread through surfaces, but we know that the incubation period can be 2 to 14 days. And what we've come to learn is that it can be spread through asymptomatic persons. And I think that that's the development that I think people are really coming to recognize in the last couple of days. So we saw a perfect example of this just a few days ago. In the NBA, a player tested positive for C-19, but until those test results came in, he was in a hotel ready to report to the arena and ready to compete. So a professional athlete, right, ready to compete against other professional athletes at that level, was feeling well enough to go to work, right? So a recognition that persons who are asymptomatic can have the virus and can spread it. Okay, so symptoms include coughing, sneezing, fever, sore throat, difficulty breathing, respiratory issues. And currently what we know is that the severity of symptoms are typically linked to those with underlying medical concerns. So by now, some of you have probably seen classifications from a number of organizations, public health organizations like the CDC, identifying individuals who are in high-risk categories and low-risk categories. And so that's where some of that is linked to. Certainly, if an employee is exhibiting symptoms, employers should instruct the employee to be seen through a telemedicine resource, not by going to a local medical practice or ER. There are a number of local health organizations that are offering virtual triage for that purpose to obtain those initial assessments. So recommendations, following the current CDC guidelines and World Health Organization guidelines on disease prevention, right? Hand washing, covering your mouth, avoiding close contact, avoiding raw meat and milk, seeking medical care if someone is symptomatic, reminding employees to exercise basic wellness measures, right? Good sleep practices, exercise practices, nutrition practices for organizations and positions that lend themselves to remote work options. That's certainly an option at this time. Again, encouraging employees to use telehealth services for those initial assessments. And organizations can start to consider things such as extra cleaning measures, invoking travel restrictions for business-related travel to specific impacted locations. One thing we did want to mention, just touch on briefly is regarding face masks or respirators. It does not necessarily prevent the spread of COVID-19, and in fact, employees who want to wear them in the workplace, so you as an organization, you're not requiring employees to do it, but an employee says, hey, I want to wear a respirator to work tomorrow. It's not necessarily an issue, but here in Michigan, we do have a occupational safety and health standard through my OSHA that actually requires the employer to provide those employees the standard for employees using respirators when not required, to make sure the employee understands that respirators aren't recommended for some individuals with certain medical conditions, and that the employee is responsible for ensuring the respirator is clean and getting it fit checked. So certainly employers who are requiring their employees to wear respirators or face masks, they additionally have my OSHA obligations to do fit testing as well. Number 8, should we impose travel restrictions? So certainly, as I alluded to before, the CDC has a number of classification levels based on certain areas of the world, right? And so we've definitely seen employers restricting or completely stopping business-related travel to any location with a level 3 travel advisory. And right now, that is China, Iran, Italy, and South Korea. Those levels are also being changed and updated often. So we've also seen many employers putting a hold on all non-critical travel related to business purposes. Now, personal travel is a little bit different. We generally cannot regulate the off-duty conduct of our employees when they're engaging in illegal activity, and certainly it is legal for employees to engage in personal travel. But what we can do is we can require employees to provide us notice of travel, where they are going, and we can tell them that they may, depending on where they're going, medical care could be limited in those areas, and upon the employee's return, they may be quarantined upon their return, whether that be by a public health official or whether it be a policy that you as an organization will put in place, that you're going to require employees traveling to certain places or in certain situations to engage in self-quarantine. Let's take a couple of questions.
All right, let's take a couple of questions. The first one I want to get to, because we had a couple of questions about milk. Why can't we drink milk? To clarify, what we mean to say there is raw milk. You guys can all continue drinking your pasteurized wonderful milk, okay? We had a number of questions relating to employees returning from personal travel and whether we can ask them or require them to work from home upon return. Now, as you just heard Sandy say, that is not only okay, but a recommended practice for anybody coming back from a country with one of those level 3 travel advisories. In fact, it's probably not you as the employer's decision to implement that quarantine. They may be asked to do that by the CDC or some other organization. We are seeing more and more employers asking employees to stay home after returning from a level 2 country, so a country with a level 2 travel advisory, and from cruises, okay? From a legal standpoint, you can ask employees to work from home if they're returning from one of those types of vacations, right? So they're coming from a country in which there's a level 2 advisory, and they're coming off a cruise ship. The reason is the CDC has identified both of those as potentially at-risk activities and situations in which employees should be monitoring themselves for symptoms and should consider that 14-day quarantine. If an employee is working from home, in our view, that's a much simpler question because they would be presumably paid for that time, and they've suffered no adverse employment action if in that circumstance. On the other hand, if they can't work from home and instead you're requiring them to remain off work, the question you're going to have to face then is whether they're going to be paid in some form, in some way for that time. Again, if they're returning from a level 2 country or they're returning from a cruise, both of which the CDC has said are circumstances when individuals should be monitoring their symptoms and should consider that quarantine period, employers have the ability to require folks to use paid time off, for example, to mandate that use to cover the time. The time could go unpaid if you so choose. From a policy standpoint, we see many employers choosing to provide pay, though, during those 14 days, based on the theory that if we are asking employees to do that and we want to encourage them to stay home, paying them for that time is going to further that purpose. That was a very long answer that covered about 12 questions that I had written down with regard to travel. Let me scroll down and see if we have any other specific questions related to travel that I can ask right now. Okay, you go ahead, Sandy. I think that's all we have right now related to travel.
Okay, perfect. So blending right into question number 7 here, when can I require employees to stay home? So Sarah just covered a little bit of this, but I want to step back and just think about this from a really high level. Remember that you as the employer can always it is always okay to require your employees not to report to work or to go home if they are visibly ill. So that is always okay. C-19 did not trigger that being okay. You always have the ability to do that. And as Sarah mentioned, it's perfectly fine to tell employees to stay home if they're returning from a country with a level 3 to cruise ship travel advisory, and if they've been in close contact with someone with C-19. So where these recommendations are coming from is based on the CDC guidance and threat assessment. So the CDC has developed guidance based on threat level, but remember, it can be based on geographic exposure, but also contact exposures. So as you look at any particular risk of an individual being in the workplace, it's not just where the employee has gone, but also the close contacts with people who may have been exposed. Now, also remember that if an employee tests positive for C-19 or they've been knowingly exposed, it is very likely that your local public health officials will be very involved and will be working with you and imposing a mandatory quarantine on that particular employee and working directly with you on determining that employee's contacts in your organization and what may need to flow from that to those individuals based on exposure. So number 6, also a question we've gotten in a number of different ways in a number of different scenarios. So when do I need to pay employees when they can't work? And so we're going to provide you, as Sarah mentioned, this is a developing area. So what we want to do is provide you a framework on how to think about this. And so if the federal government passes some form of relief in this area, we can plug that into this framework. And a week from now, if something changes, we can plug that latest development into this framework. So when we talk about employees who cannot work, what we want to think about with respect to pay is, why is the employee missing work? Do any federal or state laws require me as the employer to pay the employee for not being at work? Do any of our organization's policies require us to pay the employee for not being at work? And then finally, what employee relations concerns should we be considering? So now let's go through a couple of reasons and highlight some additional pieces to think about. So an employee is missing work, maybe for their own illness, maybe they are under mandatory quarantine, maybe they are caring for someone else who are ill, or maybe now they are caring for well children because the school has closed or their place of care has closed. So if they are missing work for one of those reasons, there are some obligations for you as the employer to pay those employees in certain situations. So we've talked about the federal government and we're watching for developments. But at the state level, there are many states that have paid sick leave laws. Here in Michigan, that's the Paid Medical Leave Act. And when an employee is missing work for their own illness, to care for a family member who is ill, or due to their child's place of care being closed due to public health emergency, those are all covered reasons under Michigan's Paid Sick Leave Act. So if your employee is missing work for a reason covered under one of those laws, and they've complied with your policy on how to notify you about the reason they're missing work and all of those pieces, they haven't exhausted their time allotment, they may be entitled to pay under those state laws. Next, you would turn to your own organizational policy. So what does your vacation policy say, or your personal time policy say, or your PTO policy say? Is the reason the employee is missing work, is that covered by one of your organizational policies? And does your organization require employees to draw down from one of their time off banks when they miss work, okay? The last piece, and maybe the most important piece, since we are in such uncharted territory here, is we need to, as Sarah mentioned, we need to strike the proper balance here. If the approach that our public health officials are trying to encourage people to stay home and to not have close contacts, we need to, as an organization, as an employer, we need to think about the infrastructure we have in place that encourages our employees to behave in that way. And so if you have an organizational policy that says folks must spend down their time off bank before they can take time unpaid, and that is a dissatisfier in these situations, maybe we want to think about some flexibility or just thinking about the organizational impact of those pieces. Similarly, should I discipline employees who cannot work? So we're talking about attendance policies. So I haven't, requested my PTO day, within a week of wanting the time off, and that's typically an occurrence under our attendance policy. What to do now that C-19 is impacting our work. And so similar to how we talked about whether the organization needs to pay an employee who's missing work, we want to provide you with a framework on how to address this question. So again, what are the reasons the employee is missing work? Based on those reasons, is there any federal or state law that requires me as the employer to protect the missed time from attendance discipline? Do any of our organization's policies require us to protect the missed time from attendance discipline? And what employee relations concerns should we be considering? So if I am missing work due to my own illness, is that related to a serious medical condition that could be protected under the FMLA? If it is, state paid sick leave laws, that threshold is generally much, much lower than the threshold for FMLA. It's just my own injury, illness, medical condition. That might mean that my time off would need to be protected if I've complied with all of the other pieces of that law. And also the ADA is implicated here. If I am an employee who has some kind of underlying condition, that remaining in the workplace puts me at risk, and I request an accommodation from my employer, hey, I need leave or I need to work remotely, those are the employer then must engage in the interactive process to consider that accommodation request, just like it would under other circumstances. Now, if an employee is missing work due to quarantine, that could implicate some of those paid sick leave laws. For example, here in Michigan, Michigan's paid medical leave, risk of communicable disease, if a health official has said that it is risky for me to be out in public because of transmission of communicable disease, that's covered under Michigan's Paid Medical Leave Act and several other states' paid leave laws. So even though I am not sick, maybe I'm asymptomatic, I simply am just coming back from vacation to an area with a heightened risk advisory, and so I'm in mandatory quarantine, that time could be protected. And then as Sarah mentioned, some of the public policy concerns. So again, going back to the CDC guidelines, right, those level 2, level 3, cruise ship recommendations, right, for individuals to engage in quarantine, we don't want to say, hey, those absences technically aren't covered under any of these laws because you burned your time or whatever the situation is, and we end up disciplining employees, right? So we want to work together, that the approach is a conservative approach, and so we want our organizational response to that to encourage employees to engage in the behavior that the public health officials are asking them to engage in. And just quickly, again, if I'm missing work to care for others who are ill, that could implicate the FMLA depending on the severity of the illness, if it hits that serious health condition threshold. Other state paid sick laws may include that as well, depending on the relationship of the individual. And again, if I'm missing work to care for well children, several state paid sick leave laws envelop when public school or places of care are closed. And so in addition to watching for federal developments on the paid piece, right, of some of these reasons, there certainly could be developments that require employers to protect those absences from discipline under their organizational policies as well.
All right, so let's take some questions here. Again, I'm getting lots of questions with regard to workers' comp. That was on one of the slides, wondering how in the world could workers' comp apply to this? And that is because if somebody contracts C-19 because there is an increased risk in their workplace, and they can identify that they got C-19 in the workplace, then that can fall under our workers' comp statute, okay? From a practical standpoint, as you might imagine, that is going to become very, very muddy very, very soon. And I would imagine it would be difficult for an employee to be able to point to a particular place or a particular person from whom they got C-19. But we do know from previous pandemics and global health emergencies that that is possible, and workers' comp has covered some of those types of claims, okay? Let's talk also, so I got a request for some follow-up with regard to some of the paid time questions and some clarifications. with regard to that, right? Just clarifying what we're saying here with regard to pay. If we are requiring employees to work from home, we are going to pay them for that time because they are working. So if they're exempt and they work any part of a day, we're going to pay them for that entire day. If they are non-exempt, then they need to keep careful track of their hours while working from home, and we are going to pay them for all of those hours. If they are somebody who cannot work from home, and so they are not getting paid for working, and they don't have paid time available, they've burned through their PTO, they've burned through their Michigan paid leave, and or they don't want to take PTO, okay? There is no legal requirement that we have to pay them not to work, okay? But let's talk about that more. Number one, likely the federal government is going to be offering benefits to those folks in the very near future, so keep an eye on that. Number two, many employers from a policy standpoint are choosing to do that because they want to encourage people to stay home and follow the CDC guidelines. Okay, let me pull up another question here. And by the way, I've gotten lots of questions about what about the folks who are afraid to come to work? That is coming up, so hang tight for those folks. What about, one of the questions I got is, what about all of our school employees who are not working because Governor Whitmer last night shut down all Michigan schools? Do we have to pay them? First, understand there are union contracts that probably apply to all of them, right? So those school employers are going to be taking a careful look at that. And following those union contracts and working carefully with the applicable unions. If this is a private school and there's no union available, then you need to look at your policies and what those folks have available with regard to paid time. And finally, I'll say again, likely there's going to be some federal help for those school employees who are impacted by that closure. Question was, is it all cruises or only the ones from level 2 and level 3 areas that the CDC has identified at risk? On the CDC's website, it just says cruises, okay? And let me be clear, the CDC has not mandated quarantine for anyone coming back from a cruise. That is not what they've said. What they've said is we are identifying that as a situation in which individuals need to carefully monitor their symptoms, and we would suggest considering that 14-day quarantine period. Let's take one more question and then I'll move on. Lots of questions with regard to the discipline piece. For smaller employees who don't have 50 or more employees, then obviously the FMLA doesn't apply to you. The Michigan Paid Medical Leave Act doesn't apply to you. That's correct. So your employees don't have those statutory protections. Those smaller businesses are going to be thinking a lot more about those larger policy questions. So if I have an individual who's missing work because he or she is sick with C-19, we definitely don't want that person in our workplace, and we don't want to be encouraging them to work. So are we going to make exceptions to our attendance policy to further that objective? Many smaller employers are saying yes to that question. Same analysis would apply to individuals who are in quarantine or following the CDC quarantine protocols. So you smaller businesses, you're going to be thinking about it more from a policy standpoint than a statutory standpoint. Okay, back over to Sandy.
Okay. So number 4, can I require medical certification to allow employees to work or to return to the workplace? So why this is tricky, first, we all know that the ADA limits our ability to make disability-related inquiries and medical examinations. Generally, right, those must be business-related and consistent with business necessity. So that's very high level. That's why we even take a pause in thinking, what medical documentation can I require my employee to bring back, right? So let's be clear that simple medical notes of return are okay, and fitness for duty statements, right? A simple statement that an employee can return to work. It doesn't provide us any health or disability related information. Those are also okay. Requiring an employee to engage in a fitness for duty exam is a little bit different. So pause here. Just because the employer can require a medical note of return doesn't mean that the employer should in all circumstances, right? The recommendation is that you evaluate the reason that you're asking the employee to provide the documentation. Is it crisis management or preventative? Both the CDC and a number of healthcare organizations do not want employers to be sending employees to provider offices just for these return to work notes, okay? So just because the ADA allows those, it might be more appropriate, and it makes sense to temporarily discourage organizations from requiring employees to do so unless there's an indication that that employee is somehow in one of those at-risk categories and there's a direct threat to your workplace, okay? So as we talked about, generally medical certifications to work under the ADA, disability-related inquiry is an inquiry that is likely to elicit information about a disability. So we want to be clear, asking an employee about symptoms of a cold or a flu or symptoms related to C19, that is not likely to elicit information about a disability. You can certainly ask employees if they are experiencing C19-like symptoms, ask the employee if they've recently returned from one of the CDC risk locations. You can do all of those things. That is not a disability-related inquiry, okay? As always, you have a duty under the ADA to maintain all of the information that you learn about an employee's illness as a confidential medical record, okay? Now, medical exams under the ADA, a procedure or test that seeks information about an individual's physical or mental impairment. So remember, we talked about a fitness for duty exam. A fitness for duty exam is a medical exam under the ADA, and disability-related inquiries and medical exams are allowed under the ADA only if they are job-related and consistent with business necessity, right? So that means that the employer has a reasonable belief based on objective evidence that the employee's ability to perform the essential job functions are impaired, or the employee will pose a direct threat to the employee themselves or to others. And the direct threat standard is high. It's a significant risk of substantial harm to the health and safety of employees or others. And that has to be based on an individualized assessment, and employers are required to consider reasonable accommodations. So what makes sense here, again, is to turn to the CDC recommendations. So the CDC guidelines regarding certain risk categories, evaluating the likelihood of risk, right, under that direct threat analysis, depending on what you know about the geographical exposure or the contact exposure or the risk category that any particular employee may be in, okay? So where can we look for guidance with respect to the ADA specifically? So the EEOC does have guidance on its website, specifically talking about how they will think about C-19, and they are actually pointing us to their guidance from 2009 when we were talking about pandemic influenza. And so they've provided us some information about when they believe that an individual, or based on a public health issue, an individual meets that direct threat standard. So as they've indicated here, whether in that situation pandemic influenza rises to the level of a direct threat depends on the severity of the illness. If the CDC, state or local public health authorities determine that the illness is like seasonal influenza or the 2009 spring-summer H1N1, it would not pose a direct threat and therefore would not justify a disability-related inquiry or medical exam. However, by contrast, if the CDC or state or local health authorities determine that, in that case again, pandemic influenza is more severe, it could pose a direct threat. So I will say that when we started drafting this presentation, I think we were further away from hitting the direct threat threshold to where we are today. Again, because the situation is developing, we certainly have seen the response by our public health officials and our own state government authorities taking a very conservative approach. So whether an employer could have met this standard a week and a half ago, I think it looks very different than what it looks like today. So generally, the assessment by the CDC or public health authorities would certainly provide an employer the objective evidence it would need to make those disability-related inquiries. And so since the EEOC has said that they're going to turn to the CDC for guidance, that's our recommendation at this point as well. And remember, those CDC risk levels are based on geographic exposures and contact exposures, as well as any underlying health conditions of any particular employee. So one question we have gotten is specifically been about thermal temperature scanners. Can I, can our organization require employees to have their forehead scanned when they report to work? And if they have a fever, can we send them home? So again, we turn to the EEOC what they would think about that. And they've pointed us back to their guidance from 2009. And they say generally that those thermal temperature scanners are likely a medical exam under the ADA. But remember, as the threat or symptoms become more severe, or public health officials make the determination that it is becoming widespread in a particular community, employers certainly may measure an employee's body temperature because it's hit that direct threat threshold, allowing employers to engage in medical exams.
Okay. Before I get to a couple of questions, we have breaking news here in the 10 Northwest Conference Room at Miller-Johnson. Governor Whitmer just signed an announced and signed an executive order that's banned gatherings of more than 250 people in a single room, hall, cafeteria, auditorium, theater, or gallery. Now, manufacturing clients, before you picture your giant manufacturing area, don't panic. There is an exception for gatherings for the purposes of industrial or manufacturing work, mass transit, and the purchase of groceries or consumer goods. Now, to be clear, this does not appear to be 250 people in any workspace. It's in a room or a hall or a cafeteria or an auditorium. Okay, so any employers out there who have larger workforces and are not manufacturing, and you have large number of people working in a single room, for example, call centers come to my mind, This is something that you're going to want to reach out to legal counsel about pretty quickly and determine your next steps and how this applies to you. Okay, now I'm sure to get lots of questions come in about it. I'm sorry to tell you all, that is all I know about that right now. So let's move on to other questions. I want to go back to this idea of when we are asking our employees to self-quarantine. I'm getting a lot of questions about if they have a stuffy nose or if they've been to Florida, should we ask them to self-quarantine? What you want to do is carefully track the CDC's latest recommendations with regard to who they are suggesting should consider self-quarantining, and you want to follow those, okay? So that's a really easy approach for employers. That the CDC's recommendations are going to change frequently, okay? So maybe make it a practice every day you come to work, pull up what the latest guidelines are from the CDC and see if that's changed. And that's really what you should be applying to your employees. We answered the question about should we take employees' temperatures at work. I do want to make sure one thing is clear to everybody, because we've also been working carefully with our healthcare organization clients on how we can be best advising employers to support them. They are asking that employers not encourage or require their employees to be seen in person for non-emergent conditions. Okay, so they are asking you all to please not require your employees to go see their doctor in order to get a note saying they're healthy. And they're asking you to stop doing that in the short term so that they can focus all of their resources that they have into this public crisis or health crisis that they're anticipating is coming, okay? The other thing I'll say is our healthcare organizations are doing a fantastic job of being very on top of this and setting up virtual triage systems. Sandy mentioned that for individuals to contact if they're exhibiting symptoms of C-19. Spectrum Health has one that's going right now, and it is free. That initial triage is absolutely free. Okay, so if you have an employee that is exhibiting symptoms or tells you they're exhibiting symptoms, your immediate response to them is easy. Okay, reach out, use Spectrum Health's virtual triage, contact them, and let those healthcare providers sort out whether there's cause for concern and whether that person should be tested. Just got a question, does the 250 number cause casinos to close? We do not know anything except what I just read to you right now, okay? So we will, trust me, Miller Johnson attorneys are going to be working on that all afternoon to get answers to some of those questions, and we will be putting out a client alert on that in the near future, okay? One question is the Kalamazoo area considered a direct threat area? Can we take temperatures of employees starting today? The Kalamazoo area has not been identified by the CDC as any sort of area of or a level 2, a level 3 advisory area. So the answer to that is no. Okay. Question about large churches being impacted by the governor's order. Yes, I would imagine that is going to impact churches over the weekend. That would be a gathering of more than 250 people in a single room. And on its face, having that would continuing to have a service of more than 250 people would violate that executive order. My advice would be to not do that this weekend. Okay. Sandy.
Okay. Number 3, so getting to a question that we know several came in, can I require employees to work if they fear being at work? So how we need to think about this. So under our occupational safety and health statutes, here in Michigan, that's MIOSHA, right? As an employer, we have a general duty to maintain a safe workplace. And those statutes include anti-retaliation protections, right? So an employee who refuses to work in a condition where an imminent danger exists, we as an employer cannot require them to do so, and we cannot discipline them for refusing to do so. However, we need to think about the level, right? When we talk about imminent danger, an imminent danger exists if a reasonable person would agree that there is a real danger of death or serious injury. So again, because the threshold is imminent danger, death, serious injury, we want to go back and take a look at that CDC guidance, right, to determine the risk level associated with the employee who is refusing to do the work. And remember, because it's not just geographic exposure or even contact exposure, we have employees with certain underlying health conditions who might be at higher risk, right? That's going to be an individual assessment generally. We can't say, nobody here in our workplace has tested positive, so nobody can refuse to do the things that we're requiring them to do each day. We need to take a look at that depending on the particular circumstances of the individual making the request. But generally, if there's no real danger, an employer can require an employee to work. And so again, under the ADA, we have employees with underlying disabilities that have a greater risk, and we're obligated to engage in the interactive process, right? So we need to consider accommodations, and working from home can be an accommodation. Leave can be a reasonable accommodation. Again, that's an individualized assessment based on that employee and the work that they do. Okay. Number 2, what if we need to shut down some or all operations? So let's first start with needing to shut down operations. So if you're in an organization that your supply chain has been affected, or you lack orders or customers, or you simply now have a staffing issue, you're not able to maintain operations as you normally would have, that would trigger a need to think about shutting down operations or trimming them in some way. So first, we want to take a look at your own layoff procedures contained in your organizational policies or within collective bargaining agreements to make sure that you are following your obligations under your own requirements. Depending on the size of your workforce and the duration of what the shutdown could look like, there could be potential WARN Act obligations that you would need to follow. Generally, again, if a schedule is reduced, you can require use of paid time off, even for exempt employees, but a lack of work could trigger eligibility for unemployment benefits. Again, this may be an area that is continuing to develop even later today and over the weekend in terms about relief for individuals impacted by C-19. So we will continue to follow those developments. But now let's think about, what if we want to shut down operations? So we don't have a staffing issue necessarily right now. Our customers are still putting in orders or coming in, or we don't have supply chain issues. What are some things we should be thinking about? So by now, I'm sure we've all heard this term, social distancing. And so what that is defined as is remaining out of crowded public places where close contact, and remember that means within 6 feet, of individuals for more than 10 minutes with others may occur, and avoiding mass gatherings, maintaining distance from others when possible. And so this is really a business decision, right? And so as we look at what is happening around us and even the developments over the last couple of days here in Michigan, we certainly see our public health and state government officials taking a very conservative approach, and as Sarah just read the executive order, putting in some infrastructure around required social distancing, okay? And so if that makes sense, some things to think about whether that makes sense for your workplace or workforce, and things to think about. First, again, evaluate your risk based on the CDC or your local public health guidance. Certainly, if you are in an area with widespread community transmission, that puts you into a higher risk and maybe makes much, much more sense for you. Take a look at the kind of work you do. If you're an organization completely made up of individuals who can remote work, this is maybe an easier decision for you. And so you'll want to evaluate the kinds of positions in your organization that lend themselves to remote work and what kind of infrastructure you're putting in place to allow employees to be able to do that. Is the technology available? Those pieces, and that's a factor in your decision making. Another factor is responding to your own employees' fears. So if you're an organization who hasn't received one phone call from this, from your workforce, that might generally be an indication that this is not particularly top of mind, that employees feel that the risk of exposure while at work is high. But if you're an organization that the fears that employees have expressed to you has only increased over the last couple of days, that's also a relevant data point as you think about whether implementing social distancing procedures in your own workplace makes sense. And this last bullet point, it was theoretical a couple of days ago, but here we are, right? So you have to think about responding to other factors impacting your workforce. And so with K-12 public schools in Michigan closing effective Monday, we, for those with employees who have school-aged children, that is something outside your workplace that will impact their ability to come to work. And so thinking about the factors that would lend itself for your organization to put in some social distancing infrastructure makes a lot of sense. Okay. And our last question before we talk about the questions we received, right? What should I be communicating to employees right now? And if you haven't already, you do need to be putting together a response or some communication. The goals of your communication, you want to demonstrate knowledge and instill calm and confidence among your employees. So you want them to know that you are thinking about this. You are thinking about this, and these are the things that you are considering, and this may be how it may impact the workplace today, or these are things we're thinking about if the situation continues to develop, right? So today, right now, we want to remind our employees that their safety is your organization's highest priority. And if it is true that there is no immediate risk or cause for concern, you want to say that. You want to say, we have no reason to believe that our workplace has been identified as a high risk or medium risk organization or area, right? Then you'll want to go ahead and detail what your organization is doing to limit the risk to your workplace. So remember, at the beginning of this presentation, we talked about how to keep it out, right? How to keep the virus out of your workplace. Talk about the measures that you have already put into place, right? So encourage your employees to follow the CDC and WHO guidelines regarding their own good hygiene practices and good health practices. Remind your employees about any travel restrictions you're putting in place, or self-quarantine that you're recommending or requiring. If you've taken extra measures to clean your organization, tell your employees that. If you're putting into place additional social distancing measures, communicate those pieces. If remote work is now available to a certain segment of your employee group, communicate that and communicate how you are going to support those employees to be able to continue to do their job, even if they're not here in your workplace. We also want to talk about as much as you know, right? Providing some information about your policies. So if you've made decisions about how employees will be paid regarding time off, knowing that developments are coming, you're going to want to talk to them about that. So if your current stance is we follow our paid time off policy, go ahead and say that, but also talk about that the situation is developing, and as your organizational response to that changes, you'll communicate it. Talk about what, if any, changes you're making to your attendance policies. Remind your employees about anti-bullying and employee dignity policies, right? So we're not going to treat employees of a certain national origin in a discriminatory manner or a harassing manner simply because of stereotypes that are associated with how the virus began and how it has been spread. I think it's very, very important to communicate to your workforce that this situation is developing, it is changing, it is fluid. So the things that you're doing today may change based on the recommendations of our public health and government officials. And then most importantly, you want to identify a resource at your organization that employees should contact if they have questions, or where employees should go for more information and continuing development. So if you have a site or a page on your employee intranet as an example, and you're saying we're going to post all of our most updated information there, make sure you say that in the communication. And lastly, you need to think about your future communication, right? Because it makes sense now to spend some time intentionally drafting an employee communication that you will use when there is a positive case in your workplace. And drafting that communication also makes you start to think about what you will do. How will you respond? So we want to remember, if and when an employee is positive for C-19, you should get the employee out of the workplace if they are still there, which is somewhat unlikely for several reasons, but also identify other employees who have been in close contact with that employee, send them home, and keep a log of all employees who have been exposed and when they were sent home. And the reason we ask this is if an employee in your workplace tests positive for C-19, again, remember, public health officials are very likely to be involved. And so when those public health officials are involved, there's going to probably be some fairly immediate contact with you as the employer asking you for this information. And so if you have the information, it's better for you to be proactive so that you can provide the information to public health officials so they can get on with the business of containing the virus and making sure they're identifying anybody who may have been exposed and be at a certain risk level.
All right, thanks, Sandy, so much. For those who are still on, I will take a few more minutes and answer some follow-up questions. For those who need to depart because it's 1 o'clock, thank you so much for joining us today. We are going to make the audio of this podcast available to all of you. So feel free to re-listen to everything we had to say today. I have had several questions about whether or not the slide deck itself is going to be made widely available, and we are not at this time going to do that. I will be honest with all of you. The reason we are not going to do that is because this information is changing so quickly. We do not want anyone to be relying on information on slides that is not accurate, for example, as of Monday. Okay, so we want you instead to be listening to the podcast and be able to put the information on those slides into context, and also be following Miller Johnson's C19 link for all of the most recent and updated information so that you have all of that. Okay, with that, let me just answer a few follow-up questions. I had a couple of folks ask, should we call MIOSHA if we find out that one of our employees has a confirmed case of C19? Who are we supposed to call, et cetera? Okay, so first I'll just point out that by the time you find out that one of your employees has a confirmed case of C19, the public health officials will already know, almost certainly. You will not be the first one to find that out, okay? So it is perfectly appropriate to contact your local health officials if you want to do that, to confirm they are aware of the situation. That's fine. The CDC doesn't want to hear from you, however, okay? So that it would be the local health department. And they will, what will happen next, at least based on our experience to date, is that they will be in contact with you and they will ask for the names and contact information of all of your other employees who were in close contact with that employee, and you will be required to turn that over to them. So you can anticipate that occurring as those employees who are in close contact with that person are asking you questions. Just assume, yes, you are going to have to provide their names and contact information to the local health department as well. All right, so let's talk about unemployment benefits. If you cease operations, or quite frankly, even reduce operations, your employees can apply for unemployment benefits just as they always can. One of my questions that I got was, would they have to exhaust their available paid time off before they applied for unemployment benefits? And the answer to that is no, they would not. Anytime somebody's placed on layoff, they can go ahead and contact the unemployment agency and seek those benefits. Again, we expect those benefits are going to be expanded through our Congress sometime today as well. Question was, is it illegal to call the Kent County Health Department with regard to an employee who is a confirmed C19 case? That would not be illegal, but I promise you they will already know about it at that point. If a location does have an employee who tests positive, should we close the location until cleaned or others are tested? That is going to depend largely on the contact that particular employee had with that workplace, right? And how extensive that was. If it's an individual who came and only sat in their office all day, right, and we feel comfortable that we can clean the places that they were in contact with, then that's one thing. If that's not the case, then an employer might want to consider temporarily shutting down and cleaning the entire location. I would expect, in addition, your local health authority is going to have lots more advice and information on that for you as well, should that come to be. Okay. How do we respond to hourly employees that do not have the ability to work remotely from home? What should we offer them? Okay, so remember, they're hourly. From a legal standpoint, we only have to pay them for the work they actually perform. So that is going to be a question for your organization from a policy standpoint. Many employers are choosing to pay employees not to work in order to encourage them to stay home and follow the CDC guidelines. We recognize that is contrary to what we usually do, but these are very unique circumstances that we are living in right now for sure. We have a lot of questions about healthcare employees who will very likely come into contact with people who are positive for C-19 and whether we can require them to work if they have safety concerns. I think what we're going to do as a section with regard to those concerns is look for us to put out some specific material answering those questions. That analysis is probably too complicated to get into right now in this webinar. But we will stay tuned. We will get back to you guys with some specific guidance on that regard. All right, just a couple of final questions. What do we do if we're a restaurant and a customer is visibly ill when they're in our restaurant? We're living in new times, guys, right? As a general practice, I don't think a lot of restaurants would have a week ago said we're going to kick out a customer because they look sick in our restaurant. That's not how we generally treat customers in this world. We're living in a unique time, and what I would say is I don't see any legal reason why you have to let a customer stay in your restaurant when they are visibly ill. And we are also very aware that your other customers in the restaurant are probably going to complain and be concerned about it. So that's a sensitive thing you're going to have to handle on a case-by-case basis for sure. But there's no legal obligation to serve somebody because they look like they have the flu, right? You could ask them to leave if you believe that was the right approach. All right. Thank you all for joining. I think we've covered the questions that we can cover today. As I've said several times, we are going to stay tuned. We are going to be putting out a lot more material. Your questions are going to change, and we know it. And so we will be keeping you all up to date. Thanks so much.
Thank you.